Well, like for example, increasingly, clinics and hospitals sitting right there on their laptop make all the entries and information.
Mhm.
So why doesn't that supersede the need for what you're doing
Because it's human error.
on their part?
It's human error. There are a minimum of 3 people who are touching your information on the healthcare profession side. And things happen. And because it is electronic, it's very easy to press on the screen an incorrect ICD-9 code, which is your diagnosis. That becomes part of your permanent record that goes to your insurance companies. And even though a doctor may say, oh, you're right, you came in for a cold, and the code I punched in, yeah, it was inaccurate because you don't have COPD, that's still in your records that you came in for COPD, and an insurance company is always looking for a way to raise those insurance rates.
So
And they're
if you
gonna
have the
say, well,
documentation, you can say, wait a minute, that's not right.
that's not what I came in for, doc. I came in because I had a cold, and now my insurance company says that there's this. So a doctor can write a letter or let the insurance company know that, you know, this was technical error, or however they want to put it, because you've got those notes. And when you come to a doctor and you show that you've got these notes, and a doctor sees that you're taking notes, which I've also got a form in here that makes it so easy to do, a doctor looks at the patient differently. And by the way, now we're not called patients, we're called beneficiaries. I think that's a step down from being a patient. I don't like that at all, because a beneficiary is just somebody who exists and they receive things for doing nothing except breathing. And somebody else or something else has to die before you become a beneficiary when it comes to like life insurance. So what I intended this to do is to make us a colleague. Let's be a team, let's be partners. And the only way we can do that.
That's the whole pitch in healthcare now, is we want to make the patient a team.
We have to be a team. But how can we be a team if we can't communicate? If I, as a patient, because I won't call myself a beneficiary, if I don't know how to communicate effectively to my healthcare team, then we're just doing nothing but wasting time. And if they've got 7 minutes to see me, I want all 7 minutes. I don't want to waste 5 minutes trying to get down to what is it that you really want to know from me.
Interesting.